Welcome to the 2021 Beneflex Benefits presentation. My name is Lori. I'm on the benefits team in risk management and insurance. I am going to discuss the health plan and other supplemental benefits offered. Some important information you need to know as a new hire. Benefit forms are due within 31 days of your date of hire. Payroll deductions begin 1 month in advance. Some of the supplemental benefits offered are guaranteed issue, and if you're covering dependents on medical, dental, or vision, documentation is required. There are 20 payroll deductions per calendar year. You pay for 12 months of coverage during the 10-month school year. You pay 1 month in advance, and every deduction pays for a portion of your summer coverage. Some summer premium may be owed upon your initial enrollment, or if you change benefits during the year, you may owe premium or you may be due a refund. The statement of benefits form and the Beneflex enrollment and change form are required. The standard disability application is required only if you are enrolling in the standard disability program. The standard online medical history statement is required for employees enrolling in over 100,000 or if you are electing life insurance for your spouse. You can choose from 4 medical plans. All 4 medical plans offer preventative care covered at 100%. Primary care physicians are not required. You do not need a referral to see a specialist. All 4 plans have national provider networks. For the Select Open Access Plan, the Choice POS2 plan, and the Cdhp plus Hra Plan, the out-of-pocket maximum is $5,000 for individuals and $10,000 for families. For the Basic Essential Plan, the out-of-pocket maximum is $8,550 for individuals and $17,100 for families. So which plan is right for you? The Select Open Access Plan requires that you stay in network. There is no out-of-network coverage. There is a national network of providers. There is no per calendar year deductible, and you pay copays for all services. The Choice POS2 plan has in-network or out-of-network coverage. There is a national network of providers. You must meet a per calendar year deductible, $500 individual and $1,000 for families. After your deductible is met, you pay 20% for in-network and 40% for out-of-network providers. The Cdhp plus Hra plan requires that you stay in network. There is no out-of-network coverage. There is a national network of providers. You must meet a per calendar year deductible, $1,500 for individuals and $3,000 for families. You will receive a health reimbursement allowance of $500 for individuals, $750 for employee plus spouse coverage or employee plus children coverage, and $1,000 for family coverage. The Hra health reimbursement allowance helps to offset your calendar year deductible. You will receive a MasterCard debit card, which is separate from your medical ID card. Currently, all funds remaining on your Hra account at the end of the calendar year will roll over, but there will be a maximum carryover amount effective at the end of the 2022 plan year. The Basic Essential Plan is a new low-cost plan, but with higher individual deductible and higher out-of-pocket maximum compared to the other Pinellas County school plans. You must stay in network. There is a national network of providers. There is a $50 copay to see your primary care physician. For all other services, you must meet a per calendar year deductible, $2,300 for individuals or $6,900 for families. After your deductible is met, you pay 30% for in-network providers. Pharmacy, a 30% coinsurance applies after you meet your medical deductible for specialty medications. All 4 medical plans come with the Aetna prescription drug program. There are 4 levels. Level 1 is generic drugs. For the Select Open Access, the Choice POS2, and the Cdhp plus HRA plan, there is a $15 copay for all generic drugs. For the Basic Essential plan, a $25 copay applies, no deductible. Level 2 is preferred brand drugs. There is a $60 copay for all plans and no deductible. Level 3 is the non-preferred brand drugs. You must meet a per calendar year deductible, $250 individual, $500 family. Then you pay a $90 copay. Deductible does not apply to the Basic Essential plan. Level 4 is specialty drugs. For the Select Open Access, the Choice POS2, and the Cdhp plus HRA plans, you must meet a per calendar year deductible, $250 individual, $500 family, then you pay a $120 copay. For the Basic Essential plan, you pay 30% after your medical deductible is met. All retail pharmacies are in network, and there is a mandatory maintenance choice program. The Maintenance Choice Program helps you to have the medications you need when you need them. This program helps you save money by paying 2 copays for a 90-day supply when you fill these prescriptions through Aetna CVS Caremark mail order or CVS Pharmacy. You must call Aetna in order to opt out and fill maintenance medications at any other pharmacy in the Aetna network. You will have a 30-day fill option only. Teledoc is a program that provides access 24 hours, 7 days a week to a U.S. board-certified doctor by phone, video, or mobile app visit. Teledoc costs less than a visit to an urgent care. There is a $25 copay for the Select Open Access, Choice POS2, and Cdhp plans. A $40 copay for the Basic Essential plan. The Healthcare Blue Book program can help you find high-quality medical care at the best cost. You will earn a reward for using a fair price provider. You must log in and search for the procedure in advance in order to receive the reward. The Be Smart Pinellas County Wellness Program can help you stay active, manage disease, avoid alcohol, tobacco, and drugs, recognize risk factors, and think positive. Kaylee Bean is our on-site employee wellness coordinator. She can help you sign up to get started. If you do not need medical insurance, there is a no health board contribution. You are eligible to use a $75 per pay period board contribution credit to enroll in eligible supplemental benefits. The benefits that are eligible are the dental plans, vision plan, accidental death and dismemberment insurance, disability, Metlife hospital indemnity plan, or you can put 25 of the 75 board contribution credit onto a healthcare flexible spending account. Enrollment in no health benefits is not automatic. You must complete an enrollment and change form indicating which supplemental benefits you would like to elect. There are 2 different dental plans to choose from. The Humana Advantage Dental Plan, you must use a participating provider, in-network coverage only. There is no deductible, no calendar year maximum. Preventative care is paid for at 100%. You pay scheduled copays for basic and major services. Humana covers orthodontia for adults and children. The Medlife Preferred Dentist Program, you can use in-network or out-of-network providers. You must meet a $50 individual, $150 family per calendar year deductible. After your deductible is met, you pay 20% for a basic service, 50% for a major service. Preventative care is paid for at 100%. Metlife has a $1,250 per person calendar year maximum. It covers orthodontia for children up to the age of 19 and has an individual lifetime orthodontia limit of $1,000. iMed Vision is our vision plan. You can get a routine eye exam and lenses once every calendar year. Frames are once every 2 years. The frame allowance is $110. The contact lens allowance is $110, plus you receive a 20% discount off balances over $110. There are national retail and private practice optometrists that participate in the iMed Vision. Employee-only coverage is free. The Metlife Hospital Indemnity Plan pays a cash benefit when you or a covered dependent is admitted into the hospital due to an accident or illness. You will receive $500 for the admission and $250 per day, maximum 30 days. Pre-existing limitations apply. Accidental death and dismemberment, AD&D insurance, provides a benefit if death is due from an accident. There is a benefit for loss of eyesight, speech, hearing, or dismemberment due to an accident. All eligible employees receive $2,000 of coverage free. You can elect employee-only coverage or employee plus family coverage. Coverage amounts you can elect are $50,000, $100,000, $200,000, or $300,000. There is no application required. The Standard Long-Term Disability Program offers two options. Option 1 pays up to 2 years, and option 2 pays up to 2 years if you are totally disabled from any occupation. You may receive the benefit until you reach your Social Security normal retirement age. The pregnancy benefit pays up to 6 weeks for a normal delivery and up to 8 weeks for a cesarean delivery. You choose a 14, 30, or 60-day waiting period until the plan starts paying benefits. The maximum monthly disability benefit is based on your annual salary. Pre-existing condition limitations apply. Another way to save money is by using a flexible spending account or FSA. Pinellas County Schools offer both a healthcare FSA and a dependent care FSA. The healthcare FSA allows you to set aside your own money to use for medical, dental, vision, or prescription drug expenses. The entire amount is advanced to you on your effective date of coverage, then paid back through payroll deductions. The maximum yearly contribution for a healthcare FSA is $2,700. The dependent care FSA allows you to set aside money for your child care expenses. The maximum yearly contribution for a dependent care FSA is $5,000. The deductions are pre-tax deductions and help to lower your taxable income. Both accounts are use it or lose it accounts. All funds contributed must be used by the plan year ending December 31st. Keep your receipts for services. Documentation will be required. The Standard Life Insurance offers board-paid life insurance to all eligible employees, 1 times your annual salary, rounded to the nearest thousand, minimum of $15,000. There is guaranteed issue for new hires for employee coverage up to $100,000. Indicate the amount on your enrollment and change form. Employee coverage over $100,000 and spouse life coverage requires an online medical history statement completed, and approval is subject to medical underwriting. You can elect spouse life equal to or less than the employee's coverage with a maximum of $100,000. Also, voluntary family term life insurance is a $5,000 policy that will cover your spouse or eligible children. You can elect children life insurance, minimum of $2,000, maximum of $10,000. Indicate the amount on your enrollment and change form. Employees must complete the beneficiary information on page 3. Your primary beneficiaries must equal 100%, and your secondary beneficiaries must equal 100%. Your legally married spouse, biological children, adopted children, children for whom you have permanent legal custody, or foster children can be covered for medical, dental, vision, family term life, and dependent life insurance. Your dependent children can be covered through the end of the calendar year in which they reach age 26. Changes to your coverages may only be made within 31 days of a change in family status during the year. Some examples of a qualified change in status is marriage, divorce, birth or adoption of a child, your spouse begins or terminates their employment, you begin or return from an unpaid leave of absence, or your dependent loses eligibility under the plan. Changes may also be made during the annual enrollment period every year in the fall. Changes made during annual enrollment will take effect January 1st of the following year. Aetna Resources for Living is our employee assistance program. This program supports our emotional well-being and can give us daily life assistance. All the services offered through this free program are there for you and the members of your household, including adult children up to the age 26, whether or not they live at home. You and your eligible dependents can receive up to 8 free counseling sessions per incident. There are many online resources, financial services, and legal services offered. Voluntary products such as home and auto insurance, pet insurance, and group legal services are offered by Metlife or Horace Mann. You can enroll anytime during the year with the exception of the group legal services. You may only enroll as a new hire or during an annual enrollment period. There are many discounts offered to PCS employees: banking, cell phones, tickets at work, perk spots, theme parks, and special events, just to name a few. Visit our employee discounts page online for additional information. Retirement is through the Florida Retirement System, or FRS. You will contribute 3% of your gross pay, and you must decide within 8 months of your date of hire if you would like to select the Frs Pension Plan or the Frs Investment Plan. If you do not make a decision and notify FRS within 8 months, you will automatically default to the investment plan. You also can participate in a tax-deferred annuity program. You can defer up to 25% of your pay, not to exceed $15,500 per year. There are no contributions or matching funds from PCS. Contact the retirement team in risk management for additional information. If you are currently enrolled in a healthcare marketplace plan, you may want to contact them before you refuse the medical coverage with Pinellas County Schools. Pinellas County Schools health insurance coverage meets the standard for minimum essential coverage and is considered affordable under the Affordable Care Act. Benefit eligible employees who enroll in the marketplace plans would not be eligible for advanced premium tax credits, also called the tax subsidy, and would not receive premium assistance. For the most accurate answers to your questions, please contact me. My name is Lori, and I am with the Risk Management Benefits team. My number is 727-588-6197, or you can visit our website at www.pcsb.org/risk-benefits. Thank you.